And thank you all for joining. My name is Fabian Lash, as you can see in the screen. I'm the project manager of Search Data Hub and part of the Crisis Bureau's country support management team. Thanks a lot for participating into this. We are today talking for a topic that is definitely marking our future. Everything now is around the discussion of what the data will do in the future, what the role will be, how we can predict the future. One of the most challenges that humans are having from quite a while. And today we are trying to understand and traveling in time in year 2078. This is trying to understand what COVID-19 impacted population in Asia, that hopefully we are not getting this disease and the pandemic till this year. But in order to better understand how the data will tell us the future and how the data is also telling us the impact of COVID-19 affecting populations, businesses, households, we today are going to talk with Nepal, with colleagues Bissam and Arnold. They both will drive us through an assessment that we have done, not in the future, not simulating the future, but because the local calendar of Nepal is 2078, as well as other calendars around the globe have different dates. I can say here, for example, the Islamic calendar is in 1443, for example. But we Gregorian calendars, let's say in Europe and the US, are in 2021. Working with data like in the future, because we are tremendously doing all our efforts trying to predict, to forecast, to understand how was our past, how is the current situation, and how the future is going to look like through the data analysis and all the machine learning, artificial intelligence, things that we definitely as UNDP have to leverage at speed. Over to you, Arnold, for all of the event. Thanks.
Thank you so much, Fabian, and it's a pleasure to have all of you colleagues in the call today. As Fabian has mentioned, my name is Arnold Njogu, an information management officer with the Search Data Hub supporting digital assessments in Africa and the Asia Pacific. And today I am very honored to be hosting our colleague Bissam, who I was privileged to work with during the scare of COVID-19 in Nepal. I think Fabian has already introduced him. He was the former head of exploration at the Accelerator Lab in UNV Nepal, and is currently the UNV country coordinator in Nepal. Bissam, please feel welcome to today's show. Great.
Thank you, Arnold.
Thank you very much, Bissam. Just to set the stage, Arilda, please, would you mind bringing up the infographic that you had prepared? Just to set the stage. Sure. Thank you very much, Arilda. To set the stage for those colleagues that might not be aware, COVID first hit Nepal sometime in January 2020, and as of September 2020, when we were planning to do the assessment in Nepal, already over 70,000 people had been affected in the country, and that figure as of now is upwards of 735,000. And having been involved in this assessment from the very initial stages, I'm aware that quite a number of other studies and assessments were already being conducted in the country to gauge the situation about how COVID-19 was already affecting the population in Nepal. So Bissam, what drove you to do this assessment? What kind of data were you looking for that was already not being sourced from these other sources? And why did you target this kind of target groups that you went for?
Sure. Thanks, Arnold, and thanks, Fabian, as well. Good evening from Nepal, colleagues. I hope you all are doing well in this difficult time. Thank you so much for offering this stage to me in order to share about our digital assessment that we did in Nepal, and also making me a part of the first series of first episode of the Data Talks series. So as you can see in the infographic itself, we try to focus on diverse respondents and diverse areas of individuals as well. We had 1,775 total people who were interviewed, among which 684 were household surveys. Just to trickle down the 684 part, these household members included people from persons with a disability community, pregnant and lactating mothers, and so on and so forth. 381 farmers, 435 enterprises, mostly micro and small, because informal sector is huge here, and 275 daily wage earners as well. So these are in terms of data what we had in our fleet during the assessment. The rationale behind why we did this was because we focused on a province called Gandaki province, which is very diverse in terms of its ethnicity, its workforce, and also geography as well. And there are, and it's very touristic prone province as well, where tourism is a major income generating source. And as due to COVID, we all know that tourism was the most hard hit area. So we really wanted to do this assessment in this province, and also the provincial government had the ask to do this assessment digitally as well in their provinces. So this was a rationale, and we did this assessment in such a time that we were already in the first year of COVID, meaning that we conducted this assessment around April 2021. In Nepal, as Arnold mentioned, we had our first wave in March 2020. So we wanted to know what kind of, in terms of impact on people, on vulnerable communities, what's the status like after a year exact. So we wanted to do that. Hence, that was one of the rationale why we wanted to do it in that specific date. Another reason why we did in this specific time was that the provincial government were also developing their fiscal year budgets and plans. So we really wanted to make them informed, using this data, so that the government can also leverage on them and make some evidence-based and data-driven policies and budgets and programs for their provinces as well. So I'll stop there, Arnold, and maybe I can give the floor to my colleague from the Accelerator Lab, Ms. Alishka as well, to just highlight on some of the key findings and recommendations. Alishka, over to you.
Thank you, Bisham. Hello, everyone. I'm Alishka, and I'm currently working as the head of solutions mapping at the UNDP Accelerator Lab. So basically, I've taken the baton from Bisham, and just seeing through towards the final, finalization and also handover of this digital social impact assessment report to our officials at the Gandaki Planning and Policy Commission. So talking about this research itself, before the actual handover, we did a preliminary sharing session of the assessment, and the commission there informed us that the data-driven evidence that SEI provided would be instrumental in the fiscal year budget planning. And even though the findings of the research were not groundbreaking as such, it did provide a very raw account of the ground reality, which has helped them in accrediting their hypothesis on the socio-economic impact of COVID-19. So having said this, we proposed a couple of key recommendations, which you can see on your screens as well. So the people, especially involved in enterprises and small-scale businesses, preferred households, they did not have enough expenses to meet their daily requirements, and people actually preferred cash transfer provisions from the government. In the same way, 43% of the businesses preferred access to credit from the government through different provisions, as that would definitely help them create like a financial cushion during this difficult time. Talking about the farmer segment, we learned that 38% of the daily wage earners, they required training in new skill as a useful form of support, so that they can maybe pivot from their, what they've been doing, and then try to do something more in order to adapt to the changing times because of the pandemic. And talking about the mobile health services, 50% of the women are in need of antenatal and prenatal care, and they felt, apprehensive towards visiting hospitals. And from a report in one of our national newsletters, we also discovered that more than 250 deaths were reported from March of 2020 to June of 2021, and they were all maternal deaths because women, they were afraid to go out of their houses for regular, health checkups during this COVID time, and people also opted for home birth. And in Nepal, we don't have a custom of having, these facilities or resources to have a safe home delivery as well. So that resulted in a devastating number of, maternal deaths during this time. So these were a couple of recommendations that we've made through our findings. I think that's a couple of things that I wanted to share. Over to you, Bisham.
Thanks, Alishka. Thank you so much for really putting the findings and recommendations on point. Over to you, Arnold.
You're on mute, Arnold.
Sorry about that. Yeah, very interesting, Alishka and Bisam, to see how you are able to form these objectives and how you're actually using those objectives to serve a purpose and make an actual difference on the ground. And just picking up from where Alishka had mentioned about involving the Gandaki Provincial Commission during the assessment. Most assessments usually involve all these different stakeholders that need to be brought to the same table, bringing all their diverse expertise on one place so that you can ensure that the process is robust and eventually the results as you have gotten, they serve a particular purpose. During your assessment, in addition to the Gandaki Provincial Planning Commission, what kind of other partners were you looking for or did you go for? And what kind of benefits were they each bringing to the table?
Sure. So in terms of, I would start with the UN agency itself. Formally, I was with the UNDP, and we found the UNV to be very instrumental at that time. I'm not saying this because now I'm in UNV, but then because of UN volunteers, we were able to really implement this assessment through the UNDP-UNV tandem initiative supported by the Crisis Bureau. I think we were able to really bring that volunteers intelligence as well. We had statistician, we have economists who were supporting in terms of implementing this assessment as well. Their technical knowledge and intelligence was very much important for us. So I think I would start like a partnership with the UN volunteer was very much instrumental. And also within the UNDP team as well, as Accelerator Lab was leading this initiative, it wasn't only confined to Accelerator Lab. We also had our policy advisors who were working in inclusive economic growth portfolio, and also we had other colleagues as well who were looking after socio-economic recovery as well, who were like supporting constantly to us. So it was a cross collaboration within the UNDP country office as well. So that's another one of the added value that we found in our assessment. We worked with youths. We partnered with a civil society based in Gandaki province, where we were able to recruit volunteers in order to implement this assessment, go to the field and conduct these assessments as well in the province itself. So that was another good added value for us in terms of really bringing young people on board as well. Also through UNV, we also made sure that we train these young people who are students, who are people who lost their job due to COVID because they didn't have anything to do. So I think we thought that this was the right time to really engage them in things like this. So we were able to engage around 80 plus young people, and we trained them in the Kobo toolbox and also Power BI, so that they can also go to the field and conduct their assessments digitally as well. So I think that was also one of the achievements that we brought. So we brought youth. We also worked with other UN agency like UNV, and also we internally in the UNDP country office itself, we worked with a lot of other colleagues, and we also brought civil society partners as well, along with the Gandaki Provincial Planning Commission, which was very much important to us because as being a UN agency, we really have to work with the government to really make sure that we support their work as well, and also make sure that the Agenda 2030 is also fulfilled, and we support our technical assistance to them. So yeah, over to you, Arnold.
Yeah, Thank you very much, Bisam, for that. And it's very commendable that you involved the youth in this particular assessment and were able to incentivize them with these training programs. I saw somewhere in your blog some quite interesting comments from some of the youth that were involved in this assessment, particularly on the additional benefits that they were able to get from this assessment. So it was not only them giving to this assessment by doing all the enumeration work, but also they were able to gain something from the training. Really interesting. And just to pick up from there, again, some of these partners that you brought on board, like the Search Data Hub, some of the UNV, UNDP volunteers, they were working remotely. Considering you're also in the future in 2078, and most of us are still in the past in the year 2021, how was that assessment? How was that experience like? How are you able to coordinate and collaborate with all these? And what are some of the lessons learned when working remotely during an assessment? You yourself also being sort of being a Search advisor, having served on sort of a remote mission during this assessment.
Yeah, that's a good one, Arnold. So I think I would start with, first of all, big thanks to Search Data Hub team, because you guys made remote working much more easier. We literally conducted assessment digitally throughout and between different nations. It's almost like a north-south triangulation cooperation between different countries and different offices within the UNDP system as well. So I think in terms of remote leave working modalities, we were very much on point. There was a great communication between ourselves. We were in constant communication with the Search Data Hub team, which really made the coordination and communication effective. I think communication and coordination is very much important, whether it's working remotely or in person. Even if we work in person and if we don't have a good communication and coordination, that wouldn't work at all. So I think that was something that was very commendable among ourselves, our team, and also your team, which really worked out. There are some challenges, definitely, technical glitches while working, and making you understand about our local context vis-a-vis your also understanding your aspirations as well. There might be some challenges to understand what we're exactly trying to do, but I think we pulled it off very well. Arnold, what do you say on this? So because I felt that we were able to pull off it very nicely, even if you were not, even if some of the survey questionnaires were not contextualized, you supported us to contextualize our digital assessment service in our own local context. And we also took support of the provincial government as well on making that happen. So I think even if remotely, we were having a good communication. So that really made us, stick together like a glue, like Shia says always. So I think the partnership was really good in terms of remote working. Logistically, yes, there are some challenges in terms of trying to include diverse audiences, right? Because we wanted to make sure that our respondents also were inclusive. It's just not about, our enumerators were also, inclusive, not just the respondents. I know it's important that our respondents, the target audience that we're trying to reach, are diverse, but one should also make sure that the people who are trying to get the data from the beneficiaries are also inclusive. We tried our best, to have enumerators from persons with the disability community. Logistically, there were some challenges, and we were not able to onboard a few of the enumerators who were from the disability community, which and also the Accelerator Lab team takes as a lesson learned and really an area to be improved in the future days. Because when you're talking about digital assessments, there are a few feasibility and assessments, the capacity assessments that one needs to do when it specifically comes to persons with a disability, especially persons with hearing disabilities. So I think that is one of the challenges we faced, and something that in the future that the UNDP country office and the Accelerator Lab team or UNB would also make sure that we ensure that we have that assessment checklist for including persons with a disability as enumerators, not just respondents, but also the enumerators. So yeah, I'll stop there, Arnold. Over to you.
Thank you very much, Bisam. And just to highlight what Arilda has requested in the chat, please, colleagues, feel free to ask your questions in the chat, and we will be giving you an opportunity to raise this up during the assessment. Thank you, Bisam, for that important point on inclusivity. Actually, today morning, also the executive coordinator for UNV, highlighted this particular issue on ensuring that our workplaces are made able, or we involve and create an enabling environment for people with disabilities to be able to work together with us. So that's really commendable. At this point, I want to look at the chat and just give the colleagues in the call an opportunity to ask their questions. I see one from Anila. Anila, please, would you want to come up and ask your question?
Thanks, Arnold. I think you actually asked the same question a couple of minutes after I wrote it in the chat, and Bisham very nicely answered it. So maybe on to the next one. There are a few more in the chat. Thanks.
Thank you, thank you, thank you. On the challenges and lessons learned, yeah, that was a good one, especially in the context of COVID-19. And there are all those government regulations, people had to wear masks quite a lot. Isam, would you like to add on that, or that's okay? We can move on to the next one.
Yeah, sure. I think, yeah, because at that time, the second wave of COVID was almost hitting Nepal, and situations were again not great, as we can anticipate in upcoming years as well. So we really were cognizant of the fact that we are mobilizing youth enumerators, but we made sure that they have, minimal COVID insurances, and also they were taking precautions whenever and wherever they're going in terms of taking surveys. They have minimum criteria of physical distancing, and we got through that. No one was ill and everything was fine. But yeah, I think COVID was one of the challenge for sure, but I think every crisis brings an opportunity. It was an opportunity for youth as well to engage in something meaningful. So yeah, that was one of the challenge. In terms of lesson learned, I think maybe one of the most, I think something that I already highlighted was in terms of inclusion, not just the target or the beneficiaries only shouldn't be inclusive. The ones who really work should also understand inclusivity first, is something that I want to highlight. We should also make sure that there might be some challenges that can come while working remotely, but if we have good communication and coordination, like I mentioned before, I think we can be able to address those challenges as well. So I think these are some of the lessons that we learned, and also something that we would also focus on in the future days as well.
Great, thank you very much, Bisam. Moise Ware asking on limitations of the survey. I'm not sure whether that's any different with the challenges. Moi, would you like to come up?
Yeah, I think it's not that much different from the challenging question that was asked, actually. I think I'm okay.
Moi, I couldn't hear you, but then just I want to add something else as well, because it was a limited time. We wanted to, because this is a rapid assessment, right? It's not like a census. So for this, we had minimal, respondents. The sample size was quite minimum. 1,700 is not that great figure, but we wanted to make sure that the sampling is, it's proportionate. We gather the most marginalized one. We worked according to the leaving no one behind principle, and we really pull it off in a very scientific way as well, because we had our statistician, UNV statistician with ourselves as well, who really worked in the sample frame, sampling size, and he calculated everything, and he came with this figure. So yeah, limitation, I would say, like in terms of respondents, it could have been more, time could have been more, but as this was a rapid assessment, those were some of the limitations we had.
Right. Thank you. Perfect. Thank you. Thank you very much, Mo and Bisam, for that. And maybe as a follow-up also to Alishka, now that one of the limitations has been mentioned as time was a limitation, the sample size was also a limitation. Are there plans afterwards? And I think this is very related to the next question that Gonzalo is asking on comparing the indicators. So maybe once Gonzalo asks his question, Alishka, I'd be curious to hear, are there plans to do a follow-up survey on this, just to be able to track the progress since the last assessment? Over to you, Gonzalo, to ask your question.
Thank you. Thank you, Arnold. I hope you can all hear me well. My question is basically how, in the design of the survey, how did you ensure that the data you were collecting could lead into indicators that the production of indicators that were comparable with pre-existing ones, so that you could have an actual measurement of the impact of COVID, an actual measurement of the impact of policies that you might be interested in tracking over.
So I'll just make sure that I'm correct. So I'm reading through your question. How did you ensure that the indicators produced using the data collected in the service was comparable with pre-existing data to make sure that impacts of COVID and policies could be tracked? So yeah, as I mentioned before as well, this province where we focused on really is a touristic province, which really has its income also based on tourism, and there are few of the areas, domains where specifically is very unique to this province. For instance, antenatal care is unique, postnatal care is unique to this province, disability is unique because there is high number, and also tourism, informal sector, informal economy is also very much unique in this in this area. So we had that pre-existing data related to these very domains prior itself, and we wanted to really focus on these very clusters because these were the areas that were recommended by the provincial government as well for us to do this assessment. So yeah, in this way, we try to, in line with the ask of the government, we wanted to make sure that the indicators produced using the data were also comparable with already what the government has on their plate, which were related to these specific vulnerable communities.
Thank you very much, Wissam. And any plans to build upon these indicators and monitor them more, Alishka?
Thank you, Arnold. So there has definitely been interest from the government level as well as the country office level to really see through this assessment and not only build on the existing one, but also try and replicate it in other different provinces as well. But right now we're still at the phase of, officially launching the report. So we've yet to, get the grants where things would basically lead to, but there's definitely been interest to basically have a more sustainable way forward on whatever findings that we generate from this assessment.
All right. Perfect. Thank you very much. I can see we are out of time. Maybe just one last question from Shivani. Please feel free. And Bisa, maybe you can highlight what was the most interesting part for your assessment before handing over to Fabian to close. But first, over to you, Shivani.
Well, just wanted to know if at all you found that COVID affected migration patterns, not just looking at how it affected people who permanently live in the area, but those who come in to service some of the tourism sector every year as well. And if you found anything that according to you warrants additional assessments, and how do you plan to hand over the data that you currently have to those stakeholders who could carry out these micro assessments, if one may say, or the lengthier monitoring kind of assessments over time?
Sure, thanks, Shivani. So I think returning migrants and migrants in general are unique to Nepal itself, as we share an open border with our neighboring country, India. So a lot of people, they migrate to India and also elsewhere, mainly the Gulf countries. And also Malaysia in the Asia and the Pacific region. Gandaki is such a province that it doesn't have a connection with any of the borders, either with China or with India. It's in between, so it's a hilly region mainly, and also mountainous. There are no such returning migrants or like external migrants, internal migrants. But yes, definitely there are seasonal migrants when we're talking about tourism, and they are being hard hit as well. Among our daily wage workers as well, they're not, there were some people who are not, native to the Gandaki province. And they were for somewhere else, which were very much being hard hit as well. There are being the reason why we didn't want to do specific with the migrants related assessment was that At that time, other agencies as well, for instance, International Organization for Migration, were also carrying out these similar assessments for returning migrants, migrants in general, and also internal migrants. So yeah, so our shift was more into the government's priorities. So that's why we focused on those. But this is something that we can always look up to as well, because as I mentioned before, seasonal migrants are also unique to this province. Over to Alishka, if you want to add anything.
Maybe for the
no, I think Visham's got it covered. Yeah.
Thank you, Alishka. For the interest of time, I actually want to give this quick 30 seconds. Most interesting part of the assessment, what stood out really for you, and you can call it a wrap with Fabian just getting the final word. Bisam?
Okay, this pressure's on me, so elevator pitch here right now. So I would say UNDP tandem for sure, because I think that was the one of the most unique thing that we experimented at that time, because we, Nepal office, were one of the very few countries in the Asia and the Pacific region. I think the second country who piloted this UNDP tandem. This didn't only mobilize volunteers, but actually brought new intelligence to the country office. We didn't have a dedicated statistician before. We didn't have a economist as such before, so we were able to bring that intelligence as well. So I would say definitely say UNDP tandem, and I would like to thank the Search Data Hub team and Crisis Bureau in general as well for supporting us with this initiative, for believing us that we could roll this out, and really also to our peers who were in the headquartered level, Arnold, Shia, and Yenton, who were paired up with our volunteers in Nepal as well. So thank you. I hope that was 30 seconds.
More or less. Thank you very much, Bisam, and it was indeed a real pleasure working with you as well. Quite interesting lessons learned today on inclusivity, collaboration, youth engagement, and more. Please feel free to post all you've learned also on the Teams channel. Fabian, over to you to call it a close.
Thank you, Arnold, and thank you, Bisam and Aliska, for very interesting information that you shared with us. I have to do two quick announcements. This month and this week specifically is also the start of another important event that is following every week on Thursday. It's called the Data Thursday. The Data Thursday is an initiative of the GPN. We are putting together the Data Future platform, or the data.undp.org, the Crisis Risk Dashboard, another very important tool for prevention, early warning, and all the work on preparedness, and our Search Data Hub. Together, we will have the first session this Thursday. So I invite you to participate into this event, where we are going to talk more on the data technicality. Despite the opening ceremony, we are going deeper every week with some great partners in the top-notch industry companies that deal with data, and also other UN agencies. The other announcement is that this data talk is coming back in a month, in the same day, same time. So I'm looking forward to have all you in both events and follow us. Thank you.
Thank you very much, Fabian.
Thanks, Fabian.
Bye-bye.
Thank you. Bye-bye.
Bye, all.
Bye. Bye-bye.
Thanks, everyone. Bye-bye.
Thank you.
Bye.
Bye-bye. Thank you. Bye. Thank you and bye-bye.
Thank you, everyone. Bye.